Welcome to Healthcare IT Today. I'm John Lynn, together with special guest host Anders Brown from Tegria. The world of technology and healthcare are ever-changing in new and novel ways, and that's why we love this stuff. So join us as we discuss the latest healthcare and health IT news, meshed together in new ways which help generate ideas and new perspectives. Plus, we'll have a little fun along the way. On today's episode, we'll be talking about healthcare's inflection point and the way forward. And today's episode is sponsored by Tegria, which is a reliable and responsive one-stop shop for strategic healthcare consulting, solutions execution, and technology services. Learn more at tegria.com. And be sure to follow the show on Twitter at the hashtag HITSM and our accounts at TechGuy and the Tegria account at Tegria Together. Plus, check out our 16 years of health IT blog content at healthcareittoday.com. Excited to have you here, Anders. It's going to be a fun conversation going forward.
Yeah, excited to be here. A lot happening, certainly in the industry right now. So happy to be here. Thank you.
Yeah, for sure. In fact, it's a little bit overwhelming, right? I mean, I think that, but I actually am excited because there's this confluence of technology and data and regulation and innovation, right?
Yeah. There's a ton of stuff happening in the industry overall, and certainly I think one of the major trends we pay a lot of attention to is all this big tech, showing up in the industry. It's not lost to anybody who saw Amazon buy One Medical. That was just another in the series there. So I think that's one really interesting thing that really has been going on for the last couple of years, and will certainly shape, I think, what this looks like moving forward.
Yeah, I think big tech is a big one, right? And, it's going to influence everything. Even the startup companies that really don't even compete with big tech are like, well, what does big tech mean for me? So I think that's a big one. But, for me, it's AI everything. Like, once I saw AI that was incorporated into Scrubs management, I was like, oh, AI is going to just eat the world. I recently saw, an investor say, AI is in every single pitch deck now. But unlike crypto, which incorporated in every pitch deck for a while, it's actually going to make a difference.
Yeah. I think you have this interesting, I mean, you mentioned this idea of inflection point and where we're at as an industry. And, you had these like interesting dynamics already in place, right? You had this idea of patients wanting more and a lot of talk about the patient experience and how does this become, just an easier experience for you to get into seeing your healthcare provider. On the other hand, you have the providers that are suffering from burnout, too much technology, but this tech thing really comes in and I think changes a lot of dynamics if you're looking at the industry, because it's like, what are the moves going to be? I mean, are we going to get our healthcare from Amazon someday? I mean, how's that going to look? But I think the one thing that is consistent with that is, in fact, this idea of bringing new solutions, like you said. I mean, this idea of how to use artificial intelligence, how to use cloud infrastructure, how to do things that, in theory, both reduce the cost of actually being a healthcare system, but then also, in theory, getting better outcomes through this data. I think it's going to be a trend that, again, has started and we're going to see for a long, long time, which will be very positive for the industry.
Yeah, the big trend I'm seeing is that healthcare systems want to get out of the IT business and they want to get into the transformation business. So I don't want to have a data center. I don't want to do desktops. I need those things, right? Or, I have public cloud, right? So there will be a data center that helps me, but I don't want to do that. I want to do the stuff that's going to transform my organization, which is a big mindset change, right? Like when I think about healthcare organizations, the mindset was we're going to do it all in-house originally, and we're going to provide these great services. And we're going to, the IT people are going to say, okay, here's something for you to use, right? And I'm going to support billing so that I can bill better, right? That was IT of the past, right? And EHRs kind of reflect that, is how can I do my billing better and how can I make that more efficient? And now there's a big mindset change to say, okay, well, my EHR now needs to create a better consumer experience, to your point, because now I'm competing with Amazon on the experience my patients are going to have. And that is a huge mindset shift.
Yeah, it's a huge shift. I think you have two interesting dynamics at play. One is this whole idea of how do I change the cost structure of healthcare? And that's not lost on anybody. We've been certainly living that, and everybody's seeing the headlines and the challenges with revenue decreasing, costs rising, inflation. That's just a challenge. So a lot of this technology, to your point exactly, is specifically to try to reduce those costs, right? If I can get rid of my data center, and pay a service fee to a public cloud provider, in theory, I have more capital to take care of my community. I have more money to put to work to actually improve the lives around me as a healthcare system. I think the other important point you commented on, which we see a lot of, is this idea of transformation. And one of the things I've said to everybody I can, it's like transformation means something different to everybody, you know, and it's a fascinating trend because it, in some way, where do you start? How do I get going? I know what I want the end state to be. And so I think one of the dynamics in the industry is to be okay that you may not have everything figured out, but you need to go down a path. You need to start taking the steps. You need to, you know, head down a trajectory. But it is a loaded word for sure now, because everybody wants to digitally transform, as they say. But you know, it just means something different to everybody to a certain extent. But they're important trends, yeah, for sure.
No, it's fair. Digital transformation, everyone wants to do it, but everyone thinks they're doing it. You know, because, you know, but then on the other side, when you think about transformation, what does that really mean? That means change. And how many of us want to change, right? Many of us are comfortable doing what we're doing and we're happy, and, you know, and change is hard. Change is hard for all of us in life, in work, in business. So I think it's fun, interesting balancing that. But I think the challenge I see when I think about transformation and some of these trends is that there's a whole bunch of really painful issues and kind of universally painful issues that we're seeing in healthcare right now. The big one that stands out for me is the workforce issues. I mean, we're hearing it everywhere. And so, you know, when I look at that, I'm like, okay, how are we going to manage with a smaller workforce, with a workforce that's burnt out? That's, you know, what are we going to do to deal with that? And my answer is these trends, right? AI is going to be the solution to some of that, because it's going to automate the mundane so that, one, I'm less burnt out because I'm not doing this ridiculous task that, you know, a robot could do. And two, you know, it's going to take people that are now doing 4 people's jobs and saying, okay, how am I going to solve this? I'm going to use automation.
Yeah. We get a lot of, particularly once you get into, you know, the idea of robotics and automation, things like that, we get a lot of discussions around people in the industry worrying about, hey, is that going to take my job? What does that mean for me? Like you said, the problem is everybody has 2 or 3 jobs, it seems like, in the industry now. And so in some way, we see a future where this technology actually augments and is you know, the extra nurse on the shift, or whatever your analogy is, to help folks get more done, essentially do some of that mundane work, as you pointed out, so that people can actually do higher value work. But it is a big deal. I mean, not having enough people to physically take care of the communities and actually run the hospital is certainly a trend. And again, I think tech will be there. I think there's some really interesting emerging trends. We talk about software, but there's a lot of hardware innovation happening. I mean, literally physically robots in healthcare, and I don't mean just surgery stuff. I mean, you know, thinking about robots running around the hospital floor, fetching things and doing other chores for folks. I mean, that may be a ways out there, but you know, that technology is something that we have to kind of get right to make sure that we can do what we can do with the capacity that we have, because it is not enough, bluntly, right now.
Yeah. And I think it's interesting because that technology is there. It's starting to take drugs around, right? Robots are moving drugs around the organization. But I think what's hard for a provider that I talk to, and the ones I talk to, is that, like, okay, you can do all this robotic innovation, great, but how about you just make my EHR less painful? Like, how about you have it load quickly, right? By moving it to the cloud so it's more responsive. And, you know, that would help my burnout more than anything, is that when I click it, it actually works, right? And it doesn't go down, right? It's reliable. And, you know, that you're doing proper security so that then I don't have a ransomware incident, right? Or, you know, how about you know, build in the right templates to make me more efficient in my documentation process? Like, you know, these things are, you know, or even improve the EHR, you know, so that it makes my life easier. Those are the pain points that I hear most, which I hear him say, I hate the EHR often, right? And what they hate is often the regulation and the reimbursement requirements, but there is some things you can do from a configuration standpoint to make it less painful as well.
Yeah, I think you have 2 interesting dynamics at play. One is you're really coming off of, as you point out, really a decade-long run in deploying these platforms, this infrastructure, this EMR, you know, nervous system, I call it, that's really driving a lot of the workflow inside of a healthcare system. And because of that, what's actually happening, and again, we see this, you mentioned it, is clinicians and doctors and nurses, they actually have to be more technologists than anybody really wanted to do when they signed up for this. These are people and a community and an industry that wants to take care of their community and deliver great value and great outcomes. And so you have this interesting dynamic where, to your point exactly, how you think about getting more from what you spent the time on, and more can be, get more out of it, literally get more insight, more analytics, more things around the data you're collecting, but it could also be just get more, meaning remove it from the process of it, improve your clinical workflows, add the templates that you're referring to. That will take you a certain step forward in terms of just reducing that pressure to be a technologist inside of healthcare. Because again, that's I think what's leading to a lot of this burnout. We talk a lot about that. It's about how do we actually create an environment where, as an industry, where clinicians and nurses and doctors can get back to what they really love doing, which is taking care of patients. So it's an interesting dynamic right now.
Yeah. I mean, I was fascinated even, by the support desk and how simple things like that and how effectively you implement a support desk for EHR problems, which are bound to happen. It's normal, right? It's fine for that to happen. But if the doctor has to sit online with a support tech person who can't actually solve the problem because they're a first level and they really need that second level, that's like tremendous burnout.
Yeah, exactly. And I mean, those are the kinds of things that, if you can tackle those little things to make sure that either the answer, gotten on the first call or the first level or whatever, but reduce that kind of cognitive burden of how to dealing with the system, it gives more space, I'd say, for, taking care of patients. And it's not just on the ER. I mean, we talked a little bit about this kind of consumerization and access. I mean, there's a lot of places that you see friction in the system. One of our favorite is call centers as an example, and how many different times you might have to go around. There's a lot of stuff that you can do there to just reduce the burden on the patient, which usually means a better experience when they come in, which also then translates to a lower load on the nursing staff or whatever it might be, to actually get them into seeing the caregiver.
Yeah, absolutely. I think we underestimate how much happy patients impact the the clinical staff, because if the patient's already burnt out before they've even checked in, right? Because they have this ridiculous check-in process with paper that they've filled out 16 times already, and they know it's in the EHR, and yet you're not, you're requiring them to do it again. By the time they get to the nurse, they're all burnt out and angry, and the nurse has to take the blunt of that, right? Because you did a bad job on the front end. I think we underestimate the impact of that.
Yeah, for sure. I think the healthcare industry is not traditionally been tuned around this front door, like you said, this experience of from the moment I touch needing to have some access to through the whole process. It's really been tuned more to the outcome. It's actually so all the noise to actually get you in to see that doctor or that nurse or clinician, whatever it might be, is something traditionally we haven't spent a lot of time on, but it is actually where a lot of the feedback's coming from when you go survey these health systems. We've done a bunch of work around patient access at UC Davis as an example, down in California, and I mean they have 800,000 clinic visits a year. I mean, this is a huge process to get people in and out, and the ability to consolidate that or think about it differently, it really does go a long way to reducing the stress on the system. Because again, if it's stress on the consumer on the front end, it certainly translates over into in the building experience, which then also overflows into the provider, of course. So yeah, they're all connected. Even on the back end, on collections and payments and how many bills am I getting? These are all things that are addressable, that I think we need to spend more time on making that burden lower.
Yeah. Absolutely.
Yeah.
Well, if you're just tuning in, you're listening to Healthcare IT Today with John Lynn and special guest host Anders Brown. I want to take a moment to thank our sponsor, Tegria. Tegria is solely focused on healthcare and offers integrated, scaled solutions to improve every aspect of a provider or payer's business. From the first patient welcome experience and EHR optimization to revenue cycle management and everything in between, Tegria meets you where you are in your journey to transform healthcare and helps you move forward on a customized path to improve financial performance. Learn more about how Tegria can help you at tegria.com. I mean, it's ironic that, that's exactly what we're talking about here today, right? Is meeting them where they are. I
Hmm.
think that's the interesting challenge, is that, we have kind of a haves and have nots in healthcare as I see it, right? Is, there's some that have so much money, they don't know what to do with it. And so they have different issues with, organizational alignment and other things, right? And we have
Yeah.
some that, are just trying to survive. How do you look at it when you say, how do we address these issues, and maybe what's the wrong way to approach it?
Well, I think there's a couple of things. One is your point on this kind of bifurcation, and the large systems that actually have some of this budget around innovation or transformation. That is a different dynamic than certainly the long tail of community hospitals that are out there, community and regional hospitals that are just essentially, for the most part, trying to take care of their community and don't necessarily maybe have all those resources. I think in both cases, the idea is, fundamentally, how do you get more out of what you've put in place to a certain extent?
Mm,
And how do you actually look at this infrastructure? And whether you've done it, in a big system for a long time, or you're just trying to make steps forward, how do you actually get more out of that? How do you think about the process around those systems, or the experience around those systems? But I think that this idea of transformation can apply to both of them. But again, it might mean something different. In
mhm,
terms of what not to do, maybe I'd reframe it a little bit and say, well, what have we seen work? What should you do? One of the things, and you commented it a little bit earlier on this, this idea of transformation and innovation, is if we're not careful, it can actually backfire, right? We've seen a
mm,
lot of projects where if you try something and you don't kind of get the right buy-in, or you don't get the right sponsorship, and let's say you do a prototype or a pilot and it doesn't work, or you didn't see what you wanted, then everybody kind of throws their hands up and say, we don't have any room for innovation. That's not actually the right way. The right way is to actually take the steps forward one at a time, and to try to learn, and I'd say learn quickly, and then try to move forward again. What usually doesn't work is these large scale, we're going to transform over 5 years. The problem, in 5 years you're going to have another version of Oracle buying Cerner, or Amazon buying One Medical, or just last week you probably saw the connection up between United Health and Walmart in terms of
mhm.
value-based care. So these are trends that are happening, and so I think it's very easy to get sucked into a PowerPoint that talks about a 5 or 10 year trajectory, but really progress is made day by day on a smaller scale. And I think that's certainly what we entertain and provide to our clients that we work with, is just how to get going. And a lot of that, as we mentioned, is often centered around the EHR, which is this nervous system and backbone of what is in many of these systems now.
Yeah. I think what's interesting as I look at this and I say, well, how do we address this? What I see is that there's a lot of people who are firefighters. They're busy fighting
Yeah,
fires all day. And so I think if I were to suggest, what can people do? What can organizations do? It's look, how much time are you fighting fires? And how
yeah,
much time are you thinking strategically? As a CIO out of Florida actually taught me this principle, because he's like, the thing that I'm missing is that I'm not spending enough time thinking strategically. Now, this can go too far, right? Like,
yeah.
we could have death by committee and
Right,
planning and strategy sessions and all that, right? I mean,
right.
basically you talk a lot, but you don't do anything. So I think that's a mistake as well. But there's many organizations that, you know, could just fight fires constantly. Just look at the number of EHR tickets you have, and you'll know the
Hmm.
answer to that, right?
Yeah,
Those are all fires that to someone, and certainly you need to address, but like you need to prioritize them and decide, how much time do I want to spend fighting fires, and how much time do I want to spend avoiding future fires, and
yeah.
thinking strategically about what I can do to make my provider experience better, or the patient experience better.
Yeah.
That's the mindset shift I think people need to think.
And I think even as important is, once you solve that, do you want to do it with your capital, or do you want to work with a partner
Mm,
who maybe can do it cheaper and more efficiently to a certain extent? And again, that's where you see these bifurcation of what value provided by the system itself. Again, at the end of the day, the clinical value is there. You're not going to necessarily at all have a scenario where the doctors have to be there delivering that
sure.
value. But to your point exactly on tickets, if you're a community hospital, I'm up here in Seattle, Washington, out in Eastern Washington somewhere. Do you actually want to build a whole infrastructure for tier one, tier two support running the system, or do you want to look at other options or solutions, or partners? Because I think that's the other dynamic there, is how do you decide how to split your time? But more importantly, when you do decide, Are you going to build in that, and are you going to own it? Are you going to invest in it? Or are you going to try to work with a partner or some form of collaboration to try to get more kind of efficiency and scale out of it? Because that's that's certainly a trend in the market that we see.
Yeah, and I never understand why an organization, I mean, you go to a conference, hymns, whatever it might be, right?
Yeah.
Vibe, et cetera. Like the CIO is almost afraid to talk to vendors. Like I've seen it firsthand, and I don't understand that, because it's like, they're really partners for you. And many of them look at it and say, oh, they're so expensive. And it can be if you do it the wrong way, I think, right? But if you do it the right way, they're going to bring so much innovation and so much, like just use security as a simple example.
Yeah.
Like if you're in rural Washington, you're not going to be able to bring the best security people to secure your data centers and build all of that up. Why would you want to do that, right? It's much less expensive, especially at the scale that's needed for a security, for cloud, for reliability, et cetera. Like you're not going to be able to do that in-house. It's much cheaper to outsource that innovation, to someone else. So like to me, I've just never understood like why you don't want deep partners, because they can do it at a lower cost and even higher reliability, more security, et cetera.
Yeah. And I think, you can bring other ideas from around. I mean, that's the benefit of, and then certainly we see this where you can, not everybody's going to be able to solve these problems on their own. At some point, we all have to kind of come together, which we have. I mean, for a long time, healthcare has been a very collaborative environment where best practices are shared and lots of, connection points between leaders and healthcare systems on how do you solve things. But, if we don't, we have to put some fabric there. And I think that's where a lot of these third parties, certainly ourselves included, can try to bring some of these ideas to the table so that you don't have to recreate the proverbial wheel, every single time. I think the other dynamic, which I'll push on you a little bit on the CIO, not when I think people confuse partnering with loss of control. It's just not true. I mean, at the end of the day, it's really a budgeting and a strategy decision on how do you want to staff your team versus work with third parties. And our experience has been that folks that are sponsoring some form of discussion with vendors or with third parties, I mean, you're the ones driving the initiative. And so there's no need to kind of feel that loss of control, which that you started out talking about. Change and change management and change processes are always hard, no matter where we're at in an industry. But I think we've certainly seen some of that as well. But that's something that it just isn't really there. I mean, it's something that you just don't need to worry about.
Yeah. It's interesting to think, haven't we all lost control?
Yeah.
Like, do we, are we really in control is an interesting question to think about.
Yeah. Well, and to your point, if we don't all come together, somebody else is going to take the control, right? I mean, again, Microsoft bought Nuance, Oracle bought Cerner, Amazon bought One Medical. I mean, there are people coming to this industry to exploit the inefficiencies that we're all kind of living every day and trying to solve to a certain extent. And whether they can is a different question. Healthcare is, very complex. I certainly am new to healthcare in the last 4 or 5 years and realize the complexity. It is not as simple as, just saying we're going to, proverbially cut the middleman out, which is usually a play that Amazon would just like to run. But somebody's going to put pressure on this to change and transform. And again, I think that's the opportunity for these leaders in these healthcare systems to embrace that. As I mentioned, take these steps forward. And recognize that if we don't collectively come together and do it, somebody's going to unfortunately do it for us.
I think the other thing that's cool and exciting about right now is that there are solutions out there. Like, I think maybe many of us are so stuck in the flames, right, of the fires that are happening and the regulations, which are over, that they're a lot, right? That's a lot to deal with.
Yeah.
And there's, there's a lot of compliance, and security is super challenging right now. And there's a lot to handle right now. But what's cool is that there is solutions out there. I mean, I was even talking something as ridiculous as faxes, which still exist in healthcare and will for a long time to come. And, I was talking to one, he's like, we just need to deal with this somehow. Like it's a burden to our organization. And I introduced him to a CIO that has worked on this exact same problem and used some AI solutions to automate all the manual work that they're doing. And so it's like, that's what excites me right now, is that there are solutions to this, right? Like not everyone hates their EHR. There are solutions to configure your EHR in a better way to make it more responsive and to, improve uptime using cloud and to do all sorts of things. Like these solutions exist, you don't, it's not like, oh, okay, we're just stuck and there's no solutions. It's just not equally distributed.
Yeah. And I mean, that's part of this. How do we, express this innovation and share this innovation among folks? But to your point, these technologies are out there, and the fun part for me, again, coming really from more of a technology background, is it's not going to stop. I mean, we're going to go right from AI, which has been around for a while, making an impact today, to quantum computing. Again, these will be 10, 15-year trends, but that will transform life sciences and outcomes. We've talked about physical robotics, and how do we get people to stay at home, as an example, rather than come to the hospital, through new sensors and telemetry of what their health experience really is, and how does that going to work with the cloud? I mean, these are things that are here today, but I think more important and almost as exciting. They're big time trends that will continue for the next decade, for sure. And that's what gets me up every day. I just think it's really exciting to see this technology. And again, part of the art is, what do I apply today versus what do I wait to mature for the future? But like you said, it's here.
Well, and what's exciting is there's so many things. So the question is, what should people prioritize today? My answer is two simple things. One is, what can I do to relieve the burden of my providers? And the second is, what can I do to make sure I'm providing an amazing experience for patients? So if I think about patient experience, provider experience, that's what I'm focused on. What would you prioritize?
Yeah, I think that I'd probably cite both of those. Again, you can decide if you can do both in parallel, but I do think there are really easy steps to transform, and maybe we should be careful with the word transform, but essentially improve and move forward the patient experience. To your point, I think a lot of us have gotten tuned to other industries where, whether it's retail or airlines or whatever it might be, where, mobile phones are the first priority. We were checking in and checking out online. I mean, these are all things that are not quite to healthcare yet, but we can get there. I think that will then translate to just a better ecosystem inside of the provider, network, and inside the actual physical presence of getting your care, which hopefully should reduce some of the burden. If we can do that, and then also improve clinical workflows, make the EHR more a background thing that's a tool, not a foreground thing that is, taking cognitive load and frustrating me. I think those are the two areas. And both of those have technology components. And again, like you said before, that stuff's here today. The question is, how do you take these steps to move forward, kind of one at a time?
Yeah, sounds like they need to call Tegria. Well, Anders, this was a lot of fun. I appreciate you sharing your insights and perspectives. And thanks to all who tuned into this episode of Healthcare IT Today. I want to thank Tegria for sponsoring today's episode. And you can learn more about Tegria's healthcare consulting and technology services at tegria.com. And to find more details about our show, check out our programs page on healthcarenowradio.com, and share your voice and engage with the community at healthcareittoday.com and on Twitter using the hashtag HITSM. I'm John Lynn with my special guest host, Anders Brown. Thanks for listening. Have a great week.